Hello all. Hope you're doing well with the monster of A-Fib that you're fighting every day. And for the new, let's say the new guys with A-Fib, I just have this thing that's very important that you must know and that you must understand that there is a major risk factor with A-Fib, and that is obviously stroke. If you just Google it, if you just go into any search engine, it will show you that stroke is the biggest risk factor. According to studies, if you are AFib patient or do you have AFib or you go into AFib from time to time, you have a 3 to 5 times greater risk of developing stroke and up to 25% of all strokes can be fatal. So it's very important, and that's why the doctors are so adamant about it that you have the right treatment and that have the right medication that you take. So you also know that with age, the risk of stroke goes up, and it is something that you can prevent to some certain extent, and that is by using I call it blood thinners, but it is the fancy name is anticoagulants, just to thin your blood. Not precisely that you thin your blood, but that's what we call that the common use or the common name for it is blood thinners, and the risk increases with age, obviously, and other conditions like blood pressure or diabetes, and you have to take that into consideration. The biggest thing is that you must take the right medication for that, and with the right medication, um, these blood thinners, there's a few different types of it. The one that I'm on at the moment for the past 5 years is Eliquis. It is a Paxiban, and well, I think according to the research that I did, and even from people, there's a person that wrote a book, Steve Ryan, that wrote a book. According to him, the best anticoagulant is Eliquis, and it falls in the category of a Apaxiban. Then there are others also like Rivara Raxaban, and the name that they call it is Xarelto. And then those are the newer type of drugs. The older type of drugs that I've also had or I used previously is warfarin. But with warfarin, you have to go for regular checks. I don't even know if they still use it much, but I not too long ago, I've spoken to people that do still are on warfarin, and with warfarin, you have to go and test your INR every now and then to see if your levels are correct. So for me, the preferred one is Eliquis that I'm using on now. You have to take it in the morning and in the evening. With Xarelto, you only take it in the once a day, so you don't have to take it twice. But I like Eliquis. They say it's the best one. I take it in the morning and in the evening. There are other blood thinners, and I've talked to my cardiologist about that. And those are let's say the not as strong, and that is like aspirin and clopidogrel and ticagrelor. Those are the ones that they call it's antiplatelets. But for someone with AFib, they do not recommend that you just stay on aspirin. They recommend that you either go with something like Eliquis or Xarelto, and so that you know you are safe because of the great risk. There are obviously procedures that they talk about also, like a MACE procedure. I don't know enough about that. I haven't had one, but I've used aspirin when I was AFib free for a long time. But after that, they put me on Eliquis. First, I was on Xarelto, and then on Eliquis because I was in AFIB too much. I was in and out of AFIB, and now currently I am. They say the doctors say I don't feel as if I'm in AFIB, but they say I'm in AFIB, so they keep me on Eliquis, and I'll stay there. So that is the biggest risk factor that you have to deal with is the stroke factor. And luckily, there are medications available that you can use, and just ask the right questions. Ask your doctor what to use. But I think most importantly, if you think you're just going to stay on an aspirin, please, I'm not a doctor, I'm a patient, so I'm not giving medical advice. I'd rather say go and talk to your doctor and ask him what is the correct one so that they can put you on the correct blood thinners. Okay, see you next time.